Health per se is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Now imagine waking up every day in pain. I mean a sharp pain. A persistent pain that just, it literally wants to take your life away. Heavy bleeding, constant bloating, a belly that grows and, it becomes hardened. Not from pregnancy though, but from something else. Something silent, something hidden, and something growing inside. Now, this is a daily reality for millions of women across Nigeria. And many don't even know what's wrong with them until it's very too late. Now, do you know that in Nigeria, an estimated 4 out of 5 women of reproductive age have fibroids, whether it's diagnosed or not? And yet, most women only find out when they are battling infertility or experiencing a debilitating menstrual pain or maybe facing a life-threatening hemorrhage. So what could really be the cause of fibroid? Some people go as far as asking, is it because, I have a womb, or is it a curse now to have a womb? Could this be my village people at work, or is it my fault that I'm not married? People even ignorantly go to the gym thinking the cause of the bloating or the stomach is from the harmless food that we eat. So, if you are that person, you are not alone. On today's show, we are going to talk about fibroid, how it starts, how it can be managed, and also how it can be avoided. My name is Emedion James, and I'll be back shortly on Wellbeing Today. So I'm giving you time to go call your friend and pick your pen and your diary, because trust me, there is always something to learn on Wellbeing. Be right back. John, many thanks for staying tuned to Wellbeing Today. Of course, I said earlier, my name is Emedion James, and we will be talking about fibroid. Joining us on the show to give clarity to everything that we will talk about today is Dr. Ekomobong Udo, a senior registrar at University of Uyo Teaching Hospital. He's also a trained expert in gynecology and he's an obstetrician, and he will be with us to answer most of the questions that we have today. So because I literally don't have time, and Swift has set a time bomb on me, I'm going to start now. So Dr. Komobong, like I said earlier, will be at the other end to be giving answers to all the questions. And that's to say that if you also have any question concerning fibroid, whether pertaining to you or to someone that you know, or you just want to have a knowledge of something, just send us a message on a social media platform, and we will, read out your questions, send it to the doctor to give answers to whatever questions that you have. So let's just hit the ground running. Of course, my first question, you can literally guess it, and your guess is right, will be, what is fibroid and how are they formed in the uterus?
Fibroids are what we call growths or tumors that can be found within the uterus. They are not cancerous or almost never lead to cancers. They're just tumors of smooth muscle origin with a little of connective tissue as well that grow within the wall, within the uterus, and they can be either found within the uterine lining, that is in the uterine lining, that is the inner lining of the uterus, or within the muscle layer of the uterus. So with that, we can have fibroids that we call submucous. Those are the ones that appear to protrude within the wall of the endometrial lining. That's those ones are inside the endometrial lining, inside the lining of the uterus. And then we have the intramural, those ones that are within the muscle layer of the uterus, that is within the myometrium of the uterus. And then we have the subserous fibroids. Those ones appear to have pedunculated forms of the uterus, where a pedunculated form of fibroids, which are like stalk, they're like they hang out like stalk within the inner lining of the uterus or outer surface of the uterus. Notion of what we call uterine fibroids, and we in the medical field we
come for that detailed explanation of what
known what they have been speculated that could be genetic, could be hormonal genetic factors, and also even some extracellular matrix formation. So for the genetics, that's where we have the issue of the family history and the race being associated with it. And then for the hormonals, there are some hormones that have been found to elaborate these fibroids. The estrogen, the progesterone have been shown to elaborate that, and to further portrays that it has been shown that this fibroid tends to shrink due to the withdrawal of these hormones, actually the estrogen and progesterone. So those are the factor formation. And then the extracellular matrix are like fibrous tissue to the bind tightly this fibrous tissue to the uterine cavity. It has been shown to be elaborated more in fibroid.
A cousin at some point had fibroid, you should go for a check or something, because that's one of the causes. There is no defined cause of fibroid. I mean, it could not, when the gynecologist was actually explaining, you can't really say it's from this particular thing. It's just been speculated that it could be family history, genetics. Some even say that it's often among black women. So if you are black and you have a family history of fibroid, I think that you should go for a proper checkup. And that's not to scare you, it's just to advise you. So now the next questions will be, what are the symptoms of fibroid, and is it true that every woman at some point in their lives will have fibroid? Because this is one of the major questions in literally the hearts of women, especially black women.
First, I would like to say that it's not all fibroids that will give you symptoms that would make you might have fibroids, because they can be as tiny as minute that even the naked eyes cannot see within the uterine cavity, and sometimes it can be as large as even a grapefruit. So depends on the size. That's when it starts elaborating or showing those signs and symptoms that most women would present in the clinic, in the gynecological clinic, with symptoms like one, heavy menstrual flow or painful menses could be one, and then two, they could have prolonged menses, that their menses could be longer than expected. Because that's another one. And then they could also have pressure symptoms. You notice that they're having lower abdominal pain, severe pains, and having issues, difficulty urinating. Those are some of the symptoms. And then they could notice that their lower abdomen is getting increased in size. That's another one. And then they could have pain during sexual intercourse. It's also common, especially when they have maybe pedunculated forms of the fibroids. They could have that. And yes, those are the common symptoms that most women would present with. Women in their reproductive age, yes, they could have some form of fibroids, especially if you have those risk factors that are associated with. First of all, being a female, and then being of the black race, because it's more common amongst the black, and then the black and African, and then with these fibroids. So that means some will have it and will not know they have it because it's not giving any symptoms, any sign. While some will come down with symptoms and present to the clinic with complaints that when further investigated.
To Dr. Komobongudo now, he literally listed some of the symptoms. Prolonged menses. A normal period is supposed to last max 7. So if you notice that you've been bleeding for like 9 days, 10 days, I think you should go see a doctor. You know, I was having a conversation with my colleague prior to this time, and we're literally talking about how uncomfortable it is to just go to see a gynecologist. Like, we x-rayed how, you know, uncomfortable it is, but at the end of the day, but these guys have the answer to your problems. So instead of just staying, you know, wherever you are and then thinking you can take drugs or self-medicate, why not go to a doctor to tell you this is actually the problem? Remember, if you have prolonged menses and it's unnecessarily, unusually painful. Most times you see women who glorified, you know, not glorified per se, but then who glorify these cramps and make it look like it's something, you know, to get validation. If you notice that your menses is just way too painful, please go to your doctor. And also painful sexual intimacy, you have to see a gynecologist for the right treatment. And that will lead me to my next questions. What are the screening options for fibroid? If I notice all these symptoms, what next should I do?
First, I would like to say that because it can be as tiny as minute that even the naked eyes cannot see within the uterine cavity. The screening, most time when it's a clinical diagnosis, kind of, when clinical in the sense that the presentation, what the patient presents with, most times tie up. What we actually do, like a form